All attendees are in listen-only mode.
Hello, everyone. Welcome to our Study Tips and Time Management Coaching Clinic. This webinar is designed to help you set up a study schedule for yourself that will be effective for you to be able to cover all of the material that you need to cover within the time frames that you have that are allotted by your particular life situation. So one of the biggest challenges that our nurses face is balancing their work, family, and social lives with the need to study for NCLEX. Nurses' lives are already full with their myriad obligations, and now they have to incorporate study too. Today we're going to show you how this can be done, but I promise you it will not be easy. It will, though, be possible. And it just takes you working out what it is that you can put off for a while until you're done with this study, maybe sacrifice for a little bit, and rearrange within your own schedule to be able to make it possible. So let's look at some things. Well, let's think about all the things that we need to do in our daily lives. That includes going to work. I mean, after all, we do have to pay our bills, and it's a requirement of the program that you have to work at least 36 to 40 hours a week to be doing a full-time schedule comparable to what you would have to do here in the U.S. And then you have household chores that need to be taken care of. You have family and friends who want to spend time with you. You have exercise. We're going to church every week, maybe both of those. You need to eat. Oh my gosh, that's right. Yeah, let's get some nourishment in there. And you have to sleep. Oh my gosh, if I don't sleep, well, guess what could happen? I'm not attentive at work and somebody could die. That's not a good thing. And if I don't sleep, any study that I do is basically ineffective. And now I have to do content review and watch webinars, and I have to do Zoom calls and quizzes and exams. And how am I supposed to decide what to do first? Like, this is a lot, right? There's so much that has to be done. So we then have to think about some other things that also take up our time. Like, those are the biggies. Those are the critical things. But what about these other things that sometimes we don't even realize how much time they take up? Things like Facebook, or going to the movies, or social life, or internet apps and games, or working overtime, or studying with friends that's not really studying, or I don't know, there's so many things, right? We think to ourselves, oh yeah, I'm going to do my study now, and then, oh yeah, but let me check my email really quick. I was waiting on an email. Oh, and let me see, my friend had something going on Facebook. Let me see what she says. Okay, now I'm really ready to study. Oh wait, I need to fold this laundry. Well, I can do that and study, right? Well, that sounds familiar, I'm sure, to a lot of you, and you realize it's not quite as effective as we think it is to try to multitask. Multitask is not as effective as people have made it out to be in the past, and we're actually going to show you a better way. But for now, this might be you trying to get everything done. Right? In thinking to yourself, I have so much to do and not enough time to do it. And figuring it all out can be overwhelming. And I'm sure that you can relate, right? So we have this triangle of nursing study death is what we call it. And it looks a little bit like this. You have personal obligations that you have to meet. You have to eat. You have to sleep. You have some wants you want to do, some nights out with your friends or your husband or wife, maybe with your children. You have work obligations and schedule and pressures and overtime, and you have study obligations. But guess what? On most days, you can only pick two of those. Really? What will you do? There's a lot to consider in the choices that you make. So you're probably thinking to yourself, but I really want to pass my NCLEX. So think about this. Everyone in our program works full time, and all of them want to do their best. All of them want to pass the NCLEX. But the reality is, wanting is not enough. So you have to take into consideration that Even though your hospital may be officially understaffed, even though you have family and friends and other relatives who want a part of your time, you can't do everything for everybody and get everything done that you need to do for yourself. So it's time to do things a little differently, because a wish is really just a wish, and a want is really just a wish. Success takes action and commitment and often sacrifice. And you have to decide, what are you going to sacrifice to achieve your goal to pass the NCLEX and come to work here? The reality is, you have to say to yourself, I will pass my NCLEX and I'll do whatever it takes to get there. So if you want something different in your life, you're going to have to do something you've never done before. And for many of you, the first thing it is that you have to start doing is telling people no. I'm sorry I'm not available. This is not the time I can do this for you. Maybe another time. So the reality is, let's think about this. I will pass my NCLEX and I'll do everything it takes to get there, but how? How can I accomplish this when there is so much to do? There are only so many hours in a day, and it's up to you to spend that time on the things that are most important to you. You have to decide. You are in charge of your schedule. So it's your time. You decide how to spend it. You need to identify first and foremost the things that are true priorities for you. Make yourself a structured schedule that accounts not just for your NCLEX study time, but also your other priorities and must-dos, things like family time and sleep. And you have to stick to the schedule. That's the toughest part for most people. So we suggest using the calendar app that's in your phone or your primary device, whether it's a tablet or your laptop, and set up a schedule that incorporates all the things that you have identified as being important for you. The basic pattern for filling out the schedule is this. The first thing you put on that schedule is your work schedule. What are the days and hours each week that you are officially scheduled to work? That's your absolute required work schedule, not the extra overtime days that you typically pick up because you want to help out your boss or you want to help out your friends or maybe you just want some extra money. There's a sacrifice that may have to be made there. Because remember, it's 36 to 40 hours a week for the program. That's what we're expecting. But other than that, that other time that you might have been spending at work may have to be sacrificed. The next thing you want to put on the schedule, as weird as it might sound, is when am I going to sleep? The reason for this is because we don't want you sacrificing sleep when you need to sleep in order to be effective at work and effective in your study. And we do know that sleep schedules are driven by work schedules. Many times you work longer hours on some days than other days. On your off days, you sleep differently than you do on your work days. So you want to put it on the schedule. For each day, when do I plan to be sleeping? The next thing you want to put on your calendar is what we call the non-negotiables, your true priorities. This includes time with your spouse. What days of the week and what hours of those days are you and your spouse both in the house at the same time and awake at the same time? That's important. That becomes sacrosanct time that you need to use to stay focused on keeping your primary relationship strong, focusing on the things that you're planning and doing and have to manage and take care of for your family and your household, and making sure that you're getting the things done that need to be done. The next thing we want you to think about are your children, if you have children, or your parents, if you have responsibilities towards your parents. When each day and when during the week do you need to have time with them? Small children may need 30 minutes a day. Middle school children, they might need 30 minutes to an hour on a given day, but they may not need every single day. Older children, teenagers, they usually don't want a lot to do with their parents anyway, but you do need to make sure you're checking in with them. So maybe you need to do an hour at a time, 2 or 3 times a week with them. Whatever it is, however you want to work it out, whether it's a meal time every single day that the whole family is together, whether it's specific time with each child, whether it's bedtime and story reading, whether it's bath time, whether it's just, catching up as you're getting ready for your day or getting through the end of the day and preparing your evening meal, whatever it is, however it works best for you with your family, that's what you need to put on your schedule. And then you also need to think about, do I go to church every week? Is that a really important thing in my life? Well, guess what? We're not asking you to sacrifice that. Put your church time, your temple time, your mosque time, whatever that is, on your calendar so that it is accounted for. If you're a person who really depends on being able to exercise to get anxiety managed and handle and ward off depression, make sure you're putting that on your calendar. Now, when you look at this calendar, there will be some spaces, right? There will be some blank space that has not been allotted to anything in particular. That is your actual study time. When you fill those blank spaces in with the word study, now your entire day, every single day of the week, 24/7, should be filled up. Why is this important? This is important because this is how you are able to start saying no when historically you may not have been the no person. You may have been the yes person. And it's very hard to sometimes go from being the yes person to now having to be a no person, at least for a specific period of time until you're done with your study so that you can be ready for the NCLEX by your target test month and then your target test date. So how are you going to do that? When your boss comes to you and says, I need you to pick up an extra shift because so-and-so called off again. What you need to say is, I really do wish I could help you. However, my schedule is currently booked out for the next several months. I can only work my actual scheduled work days. And when your friends come or your colleagues come and say, hey, I need you to switch weekends with me because it's my son's or my daughter's birthday or my husband's or my anniversary or whatever the reason is, and you've already got those weekends planned out now. They're scheduled for study because those were your off days. You need to say to your person, I'm so sorry. I wish I could help you. However, the next several months for me are completely booked up. I'm not going to be able to switch shifts with people. I have to stick to my actual scheduled work days. And that's all you have to say. You do not have to apologize. You do not have to feel guilty. This is your life. These are your goals that you have set for yourself and to improve your life and your professional career and your family's life. There is no shame in that. Actually, it's something to be very proud of. So don't hesitate to now become the no person. It's only for a few months, guys. After that, you can start saying yes again. But for now, remember, this was your priority. This is your goal. You signed up for this. So make sure that you make it the priority it really is. And then what is that schedule going to look like? It's going to look a lot like this, right? Every single day of the week, most every hour of the day is going to be filled up. As you can see, this is a person who's working day shifts most days, but there are some days they're working night shifts most days. So they're working night shifts, so some days they're off work and they're going to sleep during the night. Some days they're going to work during the night. Some days they're going to sleep during the day. They're going to have time with their family. They're going to have lunch with their best friend. They've got when they need to go do some grocery shopping and maybe clean the house or other things. For this person, church is important. Then they go have lunch with their parents every week. They put those things on the calendar. The rest of the day, this is midnight to noon, right? Each of the days. The rest of the days, what does it look like? Oh, from noon until midnight, right? 11 p.m., this is what it looks like. They're finishing sleep. They have work some days, but their study time is most of the days in the afternoons. For this person, that's where their primary study time is. So now they know what they're going to do every single day, every hour of the day. And now that they have this marked out, they can go to their study modules, look at everything that needs to be covered in that set of modules for each week, and put in for their study time exactly which parts of the modules, which presentations they're going to study when. It's very important, right? It's your time, guys. You do get to decide how you're going to spend it. So you have to learn to say no. You have to know how to say no to specific things. So it could be things like, well, anything that's not your priority. And so this could be working overtime. This could be your cousin's birthday party that you probably didn't really want to go to anyways, or your best friend's party that you really did want to go to, right? But you have to decide what your important priorities are and when you're going to do things, and make sure you're focusing on the things that you need to do, not just the things you want to do, because it's more than want that gets you your pass on NCLEX. So now I know when to study, but the next question is, how do I study? That's the $60 million question, right? So you have to decide what you're going to study for each of the time slots that are allotted in your schedule that you've now built for yourself. Do not try to multitask. We have learned the lesson, right? There was this long period of time where everybody was supposed to be a multitasker, and that was something job employers were looking for, somebody that could multitask and do multiple things at once. But guess what? Over the last several years, studies have shown that this is not actually what happens. What actually happens is you are focusing on one thing at a time, just in very, very short increments. And it can be very detrimental because you end up not getting much done at all. So what you want to do is use the blocked time that you've already created on your calendar and do what you've planned within that block of time. When you're at work, focus on work. When you're studying, focus on your studies. Now, get the most out of your study time. You want to study smarter and not harder. So you have to have a process for your review. So once your schedule is set up, you need to plug in those study sessions. What am I going to study? So what would that look like? Well, it would look like this. So this person, we would say, was in Module 3. So we use the content from Module 3 to set up the study that they would focus on. So on this day, they're studying from 2 to 4. They're going to get these particular presentations taken care of. It's a total of 63 slides. On this day, they're only going to get one set of study done. On this day, only one set of study done. On this day, another one set of study done. They have a little bit of extra time. It's a slightly longer presentation, and heart failure tends to be a pretty hard topic. So having a little extra time doesn't hurt. Other days, they're going to do some other presentations. So they're going to work through each of their presentations based on how much time they have left. So in this particular case, this person actually covers all of the Module 3 content for their first run-through in the first week. Notice that their webinar time is also part of the plan. Then in their second week, they can review again, focusing on areas that were difficult or that they struggled with. And on each day of the study, from day 2 forward, the nurse should complete self-generated quiz topics for those covered the day before they start their new study. So what does that mean? So for example, they studied heart failure, I think it's Monday, Tuesday, Wednesday. So before they start studying hypertension and electrolytes on Thursday, they want to do some self-generated quizzes on heart failure. On Friday, they want to do some self-generated quizzes before they start their peripheral vascular disease and their drug table update. They want to do self-generated quizzes on hypertension and electrolytes, right? And maybe valvular disorders and IV fluids before they start their study for acid-base imbalances. That's going to get them the review they need for the content they studied the day before. And then as they're moving forward in that second week, they're still continuing to do the same thing. Remember, self-generated quizzes should only be about 10 to 20 questions per presentation. You are not trying to do all of the questions in the database. Remember, the questions in the database, even though there's over 3,100 of them, none of them are going to be on your actual NCLEX. And that would be true no matter what program you are in, because the NCLEX questions are proprietary and protected and not published anywhere. Nobody has access to those. So the questions you get on your actual NCLEX are not going to be the same questions that you saw in your study. What you will see are questions on the content that you studied. So the content is critical. The case studies and the self-generated quizzes, and then your module quizzes and your case study quizzes, and even your practice adaptive exams are for you to practice the process of analyzing your questions and applying your knowledge and using the steps and strategies that we have taught you in the Coaching Clinic series to be able to figure out the answers to any question on the content that is covered. That's what your goal is, and that's what you're practicing. So towards the end of the second week, the nurse should see which day they can arrange 5 hours of uninterrupted time for their module quiz. You are expected to answer all the questions on the module quiz, but remember, it's 150 questions in 5 hours. That's 2 minutes per question. Most people answer most questions in 60 to 90 seconds. So you have plenty of time, but you need to leave that 5 hours there. Do not anticipate completing that exam in 3 hours or 4 hours, knowing I have to be at work or whatever. No, you set up the time for your module quizzes and then later your adaptive exams to have 5 hours to complete them. And the same with your case study quizzes, that you make sure you have the amount of time needed based on what it tells you is available for that exam, because you want to complete all of those before the 5-hour mark. Now, the only difference is your adaptive exams. Your adaptive exams, you're going to do exactly like your NCLEX. There's still 5 hours. You still have to mark out that 5 hours so you have all of it available. But you are not trying to be done in less than 5 hours, and you are not trying to answer all 150 questions. You are answering however many questions you actually do get in however much time it takes you, and whenever the exam closes, it closes. You just know that it absolutely will close when you hit 5 hours or you hit question 150. But your goal is not to get there. Your goal is to simply focus on each question as it comes, answering however many questions you get in the amount of time it takes for you to answer them. That's what you're doing. So stay focused on those questions. Now, remember that when you need an extension, you simply need to email your instructor and let them know to get that approval. Typically, anything less than a week is an automatic approval, but you do have to pay attention to the accumulation of any extensions that you ask for. Anything longer than a week will take some discussion, so please make sure you ask for that timely, as well as recognize anything more than probably a couple of weeks we have to discuss with our leadership. So it's not that those wouldn't be approved, it's just a bigger conversation. So make sure you're doing the things you need to do to help yourself stay on track and to be on time with your study. Now, the next thing is make sure you are organized, because you want to be in a quiet, uncluttered space. You want to turn your phone off so you're not constantly being hit with dings and rings. You want to make sure you have snacks and drinks at hand if you need them. If you're a visual learner, keep a notebook, read, take notes. If you're an auditory learner, record yourself reading out loud and replay those recordings back to yourself. You use that record function on your phone. If you're a kinesthetic learner, you need to incorporate movement as you read and record or listen. So as you're doing your study, use the techniques that help you to be successful, because that is going to be your best way to make sure you're retaining what you study. The next thing you want to do is make sure you do develop your notes. So your notes should include, whether they're written notes or audio notes, descriptions of conditions, signs and symptoms, labs and diagnostic studies, pharmacological treatments, including side effects and adverse effects and things you need to monitor, nursing interventions, key points for client education, desired outcomes, and possible complications. So, for example, if I was studying CHF or heart failure, I would want to say, this occurs if the heart is not able to fill completely or pump adequately. Signs and symptoms include neck vein distension, crackles, frothy pink sputum, dyspnea, fatigue, and edema. And I know that depending on whether it's right-sided or left-sided, I'm going to see for left-sided heart failure, the crackles and the frothy pink sputum and the dyspnea. For the right-sided, I'm going to see that neck vein distension and that edema that comes with that, right? So those are the things I need to pay attention to. And then labs and diagnostics, well, blood pressure and heart rate, echocardiogram, ECG, cardiac enzymes, drug levels like digoxin. What pharmacological therapeutics are we going to use? Diuretics, calcium channel blockers, ACE inhibitors, digoxin. Let's pull out my pharmacology table and look at each of those drug classes. Nursing interventions include monitoring daily weights, monitoring I's and O's, administering oxygen, monitoring for dig toxicity, dietary restrictions, preventing sodium over ingestion, and also monitoring potassium. Rest, right? Outcomes. We want them to rest. We want them to be able to perform their ADLs without exertion. We want their vitals within normal limits. We want their perfusion within normal limits. Complications include pulmonary edema, electrolyte imbalances, and drug toxicities. So that's how I want to do that disease process review. Now, I also want to consider outlining, especially if I'm a read-write person. Read through your presentation once and create your outline with major headings. Go back in and fill in the topic sentences and pertinent data, and then go back one more time and fill in detailed info. What might that look like? Well, this is your endocrine system. Your system overview, the functions of each of the glands, your assessment, general assessment and focused assessment, the different endocrine glands by location, function, and hormones secreted, so pituitary, thyroid, parathyroids, adrenals. When I'm looking at the disorders of those glands, right? In the pituitary gland, I have diabetes insipidus. So that same description that we just did for CHF, I'd want to do for that. For syndrome of inappropriate antidiuretic hormone, the same things. And I might even build myself some flashcards where I put diabetes insipidus on one side and syndrome of inappropriate antidiuretic hormone on the other side. Why? Because those two disease processes are opposites of each other. And I could do the same for hypo and hyperthyroidism, hypo and hyperparathyroidism, Cushing's and Addison's disease. There's a lot of ways to do that review. The next thing I want to do is, after my quizzes and exams, review the questions. Always read the rationales for the answers, whether the question was answered correctly or not. Sometimes we can answer a question correctly for the wrong reason. So make sure you knew, why was that right answer right? Why were those wrong answers wrong? And keep a pad of paper and a notebook handy. Write down your topics of weakness after completing the exam. Write down unfamiliar terms and procedures and drugs. And always remediate. Review the content for those incorrect answers, making sure you choose to do this as part of your second review. And then let's look at a couple of questions now. You're assessing a patient who is suspected of having right-sided heart failure. What assessment finding might indicate right-sided heart failure? Well, when you look at these answer choices, you want to work through this question using your 6 steps. What is the question asking me? What assessment finding might indicate right-sided heart failure? So what is the topic of my question? Right-sided heart failure. What keywords do I have here? Assessment finding, right? And then what kind of question is this? Well, it's a decision tree, really, right? It's really a kind of a knowledge question. So when I'm looking at this, I'm thinking about, what do I know about heart failure? What do I know about right-sided heart failure? Would I be more likely to see pulmonary edema, distended neck veins, a dry cough, or orthopnea? So if you chose answer choice B, right, you got it right. But if you chose something like pulmonary edema, that might be left-sided heart failure. So knowing the difference is important. So if you chose it for the right reason, great, then you know you're good there. But if you chose it for the wrong reason, or you chose the wrong answer, you know you need to do some review of that content, right? So you want to do that. And think about it. Consider alternate kinds of questions you could see on your exam. For example, you could have the same content that's covered by this question presented in a different way. A nurse is assessing a patient who presents with distended neck veins. Which conditions might present with this sign? Select all that apply. That could be a question that would be related to the same content. So you have to know your content in order to do well on your exam. Here's another example. So the nurse is caring for a 68-year-old patient with the following presentation: blood pressure of 128/72, heart rate of 56, respiratory rate of 20, O2 sat of 97% on room air. I&O last shift was 600 milliliters of fluid in, 550 milliliters of urine out. Their potassium level is 5.3 milliequivalents per liter. and their digoxin level is 2.7, I forget what NGs are called, per milliliter. What should the nurse assess for? Wow. So think about when you take care of your patients. You walk into the room and this is what you see. This is the information you have about your patient. What matters most here? What could it mean? What am I going to assess for now in this patient? Am I going to assess for hearing loss, for vision changes, for decreased urinary output, or gait instability? Well, what is the topic of the question? What does the data indicate, right? We have a high potassium. We have a high digoxin level. So if my digoxin level is greater than 2 and my potassium is greater than 5, I know I've got some issues with hyperkalemia. And hyperkalemia can be a sign that my dig level is too high. So what are my signs and symptoms of hyperkalemia? My signs and symptoms of dig toxicity. Oh yeah, another thing, that heart rate, it's less than 60. I would be holding that dig dose anyway. So what's going on here? Oh, probably dig toxicity. Which one of these is going to tell me that? The vision changes. That's a sign of possible dig toxicity. So what am I going to do for it? I have to think about that. Because what? On my actual NCLEX, I could get this presentation and the question could be, what intervention would the nurse expect to perform? And the answer choice might be administer Digibind or Digifab as ordered, right? Because that's the antidote for dig toxicity. So making sure we know what it is that's involved in the content is about more than just the question. Another piece of this might be, what would the nurse need to educate this client on? Signs and symptoms of digoxin toxicity, when to hold their dose, when to notify their HCP, right? That's the extra information you need to know about this question. So when you're studying your pharmacology, we've talked about a little bit of drugs here, you want to be very successful with that. And pharmacology permeates every module of study. So getting set up to study this topic, or should we say these topics, successfully requires organization and ongoing review. So think about these drugs, for instance. Maybe potassium, histamines, antivirals, renin inhibitors, MAOIs, beta blockers, tricyclics, vasopressins, insulins, opioids, adrenergetics, mucolytics. Oh my gosh, how in the world are you going to remember all these drugs and all the other ones that we need to know about? Because this is just the tip of the iceberg. Well, there is a process. There is a way that you can do it. And that way is to set yourself up the studying pharmacology drug table. And we do have this attached as a handout for you to download. It is a Word document that expands and can be edited as you move through your study. So you use this organized guide to help you break the study into smaller segments to help you learn it better, retain more information, and not feel so overwhelmed as you study. So how are we going to do this? We start by building the basic table, and they're organized by body system and then by drug class. So each segment under each body system will look like this. This is an example for neurological. So there is a column for the drug class name, for the subclass name, for the action of the drug, how it actually works in the body, the uses, the reasons we prescribe it, what diagnoses are related, the names of actual medications in the class and subclass, the side effects and adverse effects that we would want to be aware of, and nursing considerations. So how might this look filled out? Well, here's an example from under the cardiovascular system. This is an antihypertensive, in particular, the beta blockers. How do beta blockers work in the body? They block beta adrenergic receptors. They decrease excitability and workload in the heart, and they reduce cardiac output by reducing the heart rate. Why do we prescribe these? Hypertension, angina, SVT. What are some options for medications that could be prescribed? Well, there's acebutolol, there's atenolol, there's bisoprolol, there's metoprolol, there's nadolol. Do I see a common trend here? Lots of LOLs at the ends of these generic terms. Your NCLEX will have the generic terms for medications. Sometimes they'll also have brand names, but recognize those will be U.S. brand names. So because they can be different from country to country, you want to list your generic terms and the brand name that you are familiar with. So if you administer atenolol and it's not called Tenormin where you live and work, well, then put what it's called there so that you know what to combine with atenolol and you'll recognize it better in your questions. Then you want to do your side effects and adverse effects. Side effects are those effects that a medication has that are not the desired effect, but that we can manage so the person can keep taking the medication. Adverse effects are those undesired effects that cause us to stop giving the medication. Sometimes a side effect can be severe enough to qualify as an adverse effect because it means we're going to stop giving the medication. So, for example, in an opioid, nausea and sometimes vomiting are side effects. And we typically give ondansetron or Phenergan or something to go with it to help manage it. But in some people, the nausea and the vomiting are so severe that the medications to management are still not effective, and the person cannot tolerate the medication. And therefore, we discontinue it and switch to a different kind of pain medicine. That makes the nausea and vomiting an adverse effect for that person. But there are some effects that are considered adverse effects across the board. In this case, with beta blockers, that would be bronchospasm. And that means that beta blocker medications are contraindicated for patients with chronic bronchitis and asthma because it can put them at risk for bronchospasm and cause them to stop breathing. They can't breathe, they could die. So we don't want to give this medicine to them. Nursing considerations, we want to take vital signs. We want to make sure they take this with meals because it does have an enhanced hypoglycemic effect and it can mask the signs of shock and hypoglycemia. So we want to be monitoring for that much more closely by checking their blood sugars and validating the need for their dose of insulin that they might be on, or maybe that their oral hypoglycemics might have to have a dosage change. We want to make sure we're staying overseeing that, making sure we're monitoring that. So that's your drug class table. So when you're studying your pharmacology, you do want to keep a small notebook with you so that every time you encounter a medication you're not familiar with, you want to write it down in a running list and then later add it to the table in the appropriate place. You could encounter medications at work, on a webinar, or on a practice exam or exam question. Make sure you're filling your table in. So study your classes, your medications by the class. As you encounter the medications and study, fill them out so that you have them by class and subclass on your table as you go. Include the action, the primary uses, the names of the medications, the key side effects and adverse effects, and the nursing considerations. You want to make sure you're filling out the entire table for every class and subclass you encounter. And then, as you do encounter those medications, make sure it's added to the table. Make study notes for any medication categories mentioned in exams and quizzes. Read the rationales in those exam quiz questions and make brief updates to your study guide as you encounter new information. Incorporate the drug table updates into your study plan as you have opportunity. Some study modules are not quite as cumbersome as others, and you'll have some times when you can say, oh, I've got some extra time here in this study block, I can update my drug table and make sure I have all of the drugs I've encountered recently on my table and the table is completely filled out. And as you're reviewing various body systems, every single day, choose 2 or 3 classes or subclasses if there's a lot of them and review them daily. Do one review when you're getting ready for work at the beginning of your day. Do another review on your meal break or at midday. And then again before you go to bed. See what you can remember from the first 2 reviews and reinforce that information for that final time. This can help you to do your pharmacology study a little bit every single day. So now you have planned your work, it's time to work your plan. So the key to any successful plan, of course, is diligence and application. We know there's a lot to do. There's a lot to cover. We know you're going to have days when you just don't feel like studying. And as you work through your study, you need to look for those opportunities where your study is lighter and plan a free day or half day for yourself every now and then. Not so many that you don't get your work done, but enough so that you get that break to help yourself refresh. And on the hard days, take a few moments and close your eyes and remember why you're doing this. What are your goals? What are your hopes for your dreams and your dreams for yourself, for your career, for your family? See yourself and your family living out those hopes and dreams. See yourself accomplishing the goals. You can do it. And sometimes if you just say to yourself, okay, I'm going to do 10 minutes of study. When you start studying, the 10 minutes quickly develops into that current total time that you need to study. And we want you to remember that as you do your study, you should only do about 45 minutes of study at a time, and then you should take a 10 to 15 minute break. You can do that up to 3 times, but after the 3rd time, so let's say it's an off day and you've planned to do study all day long, after your 3rd 45-minute study time, you want to incorporate an hour-and-a-half break, a break to go do other things off track of study. The reason for this is because it allows your subconscious mind to then process and collate and store the information you've just been reviewing so that you have it well placed in your brain to be able to pull it forward the next day when you do your self-generated quizzes, to be able to pull it forward at your module quiz time and your case study quiz time, to be able to pull it forward for your practice adaptive exams, and then again on your NCLEX day. Because that's what you're preparing for, guys. Every single thing you do in this program is geared to bring you to a successful day of NCLEX test day. And we want to see that happen for you. Pass on the first try. So that's all I have for you today, guys. If you have any questions, please do reach out to your assigned instructor. They are happy to help you with a one-on-one Zoom call and a group setting Zoom call. We are here via email anytime you need to reach us. It is our goal to see you be successful. Thank you so much for listening, and I hope you have a great rest of your day and time in the program.